film eval for my pathology paper. AP Femur. This is a 19-year-old female brought into Central Florida Regional by EMS with complaints of leg pain due to a motor vehicle accident. We received the trauma call with an order for AP view of a femur. There are no removable artifacts evident on the image. Gauze was under the patient on the trauma bed. Marker was placed on IR prior to exposure. Patient info was removed from this image. The part and the tube are positioned correctly. The patient is centered to the IR. Appropriate use of collimation for body habitus. The KVP mass for an image of the femur is 80 kVp at 12.5 mass for digital radiography. The appropriate exposure factors are evident on this image. There are an additive pathology of a fracture, and this would change the technical factors for the image of the femur. This would add to the technique. Image is of diagnostic quality. In my opinion, I would move the marker closer on the side. Radiation safety was used by wearing a lead apron by the techs. Patient was not shielded due to facility protocol and trauma protocols. On this image, you can view the left anterior superior iliac spine, the articular cartilage, lesser trochanter, medial epicondyle, and the patella. This image includes the proximal, mid, and distal femur, including knee joint. The difference I would use would be change of marker location and increase the mass for less distortion and better contrast. The second view is a specialty view in the trauma bay requested by the doctor. Again, this is a 19-year-old female brought into Central Florida Regional by EMS with complaints of leg pain due to a motor vehicle accident. We received the order for the femur AP view from the trauma doctor. After viewing the view, she requested a specialty view of the fracture. There's no removable artifacts evident on the image. Marker placed on IR prior to exposure. Patient info was removed from image. The part tube are positioned correctly per doctor orders. The patient is centered to the IR. Approximate use of collimation for body habitus. The KVP mass for an image of the femur is 80 kV at 12.5 mass for digital radiography. This would not change the technique. The appropriate exposure factors are evident on the image. There is an additive pathology of a commuted fracture. This would change the technical factors for imaging of a femur. Image is of diagnostic quality. Radiation safety was not used per hospital policy and the trauma protocols per patient. The techs were wearing lead aprons. On this image, you have the views of the anatomical neck, obtubular foramen, greater trochanter, intertrochanteric line, and the communicated fracture. This image includes the commuted fracture centered to IR as doctor requested. This image also includes the proximal and mid femur. On this image, I would move the marker closer to the anatomy and change of collimation to focus more on fracture for less distortion and better contrast.